Have you ever wondered if the pills you take to feel better could actually be harming your heart? It's a question that keeps cardiologists on their toes, and today we're bringing you the answers you need. We're counting down 6 common meds that can cause heart attacks. Get ready to discover which ones made the list and learn what you can do to protect your heart health. Let's dive right in. At number 6 we have NSAIDs. NSAIDs stand for non-steroidal anti-inflammatory drugs and include popular over-the-counter medicines like ibuprofen, naproxen, and aspirin. You might think these pain relievers are safe, but they can be very tough on your heart. It can help your body in one way, but cause trouble in another. When you pop an NSAID, it starts working to reduce pain and inflammation. That's the good part. But these drugs can make your body hold on to more water and salt. When there's more water in your body, your heart has to work harder to pump all that extra fluid around. This extra work can be really hard on your heart, especially if it's already not as strong as it should be. But that's not all. NSAIDs can also make your blood vessels tighter. When they get tighter, it's harder for blood to flow through them. This means your heart has to pump even harder to get blood where it needs to go. A study from the journal Curious found that people with heart failure who took NSAIDs were 10 times more likely to have their heart problems come back. Another study showed that people who use these drugs for a long time have a slightly higher chance of developing heart failure. But what's happening inside your body when you take NSAIDs? These drugs block something called prostaglandins. Prostaglandins do lots of important jobs, including keeping your kidneys working well. When NSAIDs block these helpers, it can mess up how your kidneys work. This can lead to all those problems such as holding on to water, tighter blood vessels, and a harder working heart. But don't panic. This doesn't mean you can never take a pain reliever again. Acetaminophen, like Tylenol, might be a better choice. It doesn't have the same heart risks as NSAIDs, or you could try a pain-relieving cream that you put right on your skin. These can help without affecting your whole body. Coming in at number 5 are decongestants. When allergies strike, many people grab pills or sprays to stop the sneezing and itching. They're effective at clearing up those pesky symptoms, but some might be putting extra strain on your heart. Here's the key issue. Certain allergy medicines, especially decongestants, can constrict your blood vessels. This action helps with allergy symptoms, but can also raise your blood pressure. For people with existing high blood pressure or heart problems, this extra pressure on the cardiovascular system can be concerning. Sandra De Palma, a physician assistant, points out that decongestants can increase stress on your heart. When these medicines bump up your blood pressure, your heart has to work harder to pump blood through your body. Now, which allergy medicines should you be most aware of? Keep an eye out for decongestants containing pseudoephedrine and phenylephrine. These are the ones that can tighten your blood vessels and potentially impact your heart health. But don't worry, there are safer alternatives if you're concerned about your heart. Nasal saline sprays can provide relief without affecting your cardiovascular system. Some antihistamines are also less likely to cause heart-related side effects while still tackling those annoying allergy symptoms. Remember, it's not just what you take, but how long you take it. Short-term use of decongestants might be fine for some people, but prolonged use could lead to more significant problems. It's all about finding the right balance between managing your allergies and protecting your heart health. Sliding into number 4 is diabetes medication. Diabetes management is a delicate balance, and for many, it involves daily medication. But what if these very medicines, meant to keep you healthy, could be putting your heart at risk? At the center of our discussion are thiazolidine-nediones, or TZDs. These medications help control blood sugar by improving insulin sensitivity. However, they come with a concerning downside: an increased risk of heart disease. A study found that people taking TZDs have a 43% greater risk of developing heart failure compared to those who didn't. So how do TZDs affect the heart? These drugs can cause fluid retention, making your heart work harder to pump blood. This extra strain can weaken the heart over time, especially if you already have heart issues. On the flip side, some diabetes medications might benefit heart health. Metformin, one of the most widely prescribed diabetes drugs, has shown promising results. A study from the journal Cardiovascular Diabetology found that people with diabetes and heart failure who take metformin have lower mortality rates than those who don't. Another group of diabetes drugs to be aware of are DPP-4 inhibitors, like saxagliptin and sitagliptin. While their heart risks aren't as severe as TZDs, research has linked saxagliptin to an increased risk of hospitalization for heart failure. If you're a diabetic, never stop taking your diabetes medication without consulting your doctor. These drugs help many people effectively manage their blood sugar. Abruptly quitting can be dangerous. Instead, have an open conversation with your doctor about your concerns and work together to create a safe plan. Remember, managing diabetes while protecting your heart health is possible with the right approach. At number 3, we have hypertension medications. Calcium channel blockers are a common type of blood pressure medicine. They work their magic by relaxing your blood vessels, which can lower your blood pressure. But here's the catch. They might also be weakening your heart muscle, making it harder for your heart to pump blood effectively. If your heart's already struggling, this could spell trouble. It's crucial to be aware of the potential risks, especially if you have existing heart issues. The main culprits to watch out for are diltiazem, verapamil, and nifedipine. Another group called alpha-1 blockers is one of the medications to look out for. One of these, doxazosin, was found to double the risk of heart failure compared to other blood pressure medications. So, what should you do? Have an open conversation with your healthcare provider about your concerns. They might suggest switching your medication, adding another to protect your heart, or monitoring your heart health more closely. Remember, managing high blood pressure is still crucial for your overall heart health. The goal is to find the right balance, a medication that keeps your blood pressure in check without putting extra stress on your heart. Nearing the top of our list at number 2 are antidepressants. When we think of antidepressants, we often picture a ray of hope for those battling depression. But did you know that these mood-lifting medications can sometimes affect your heart? There are 2 main types of antidepressants: tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs. TCAs have been around for a while, but they come with some heart-related risks. These drugs can make your heart beat faster even when you're just standing still. They can also lower your blood pressure when you stand up, which might make you feel dizzy. But that's not all. TCAs can change how your heart's electrical system works, making it take longer for signals to travel through your heart. This can lead to changes in your heart rhythm. Now, let's talk about SSRIs. One SSRI, called citalopram, has been linked to a problem with heart rhythm when taken in high doses. Fortunately, some antidepressants are safer than others. Selective serotonin reuptake inhibitors generally have fewer heart-related side effects compared to tricyclic antidepressants. But if you already have heart problems, you need to be extra careful with any antidepressant. You protect your heart while taking care of your mental health. Talk to your doctor about your heart health before starting any antidepressant. Your doctor might also want to keep a closer eye on your heart while you're taking antidepressants. This could mean more frequent checkups or tests to make sure your heart is staying healthy. Finally, at number 1, we have arthritis medications. Living with arthritis is challenging, and it's no wonder millions turn to medications for relief. These treatments can be life-changing, helping people reclaim their daily activities. But here's the twist. Some of these medications might be putting extra stress on your heart. Let's talk about biologics. These powerful drugs work by altering your immune system, which can be great for arthritis, but potentially problematic for your heart. A study on infliximab, a common biologic, found that heart failure patients taking high doses were more likely to face hospitalization or even death from cardiac issues. Now, you might ask, what can I do to protect my heart while managing my arthritis? Here are some unique safety tips to keep in mind. 1. Consider topical treatments. Creams and gels can provide localized pain relief without exposing your entire body to medication. 2. Explore alternative therapies. Acupuncture, massage, or gentle yoga might help manage pain without cardiovascular risks. 3. Mind your diet. Some foods can naturally reduce inflammation, potentially allowing you to use less medication. If you're 65 or older, you need to be extra vigilant. Studies show that older adults face higher risks of heart problems when taking certain arthritis medications. The American Heart Association emphasizes finding the right balance between pain control and heart protection. This might mean trying different combinations of treatments or adjusting your medication schedule to minimize risks. We've explored the complex relationship between medications and heart health. While many medicines are vital for our well-being, some can potentially impact our hearts if not used properly. But don't let this worry you. By working closely with your healthcare provider, you can ensure your medication regimen is safe and effective. Knowledge is power when it comes to your health. Don't hesitate to ask questions or voice concerns if something doesn't feel right. Remember, you're in control of your heart health. By staying informed, you're taking important steps to protect your heart. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the bell icon so you never miss our latest health tips. We'd love to hear from you. Did you know about these risks with common medications? Have you or someone you know experienced side effects from any of these? Share your stories or questions in the comments below. If you enjoyed this video, please consider showing your support with a super thanks. Thanks for watching, and stay tuned for more health and wellness content.